So one of them will be just a generic personal statement, and the other will break that down for you. If you're going on the side that's had it, so it's up to the employer as to which of those application forms they want. The one that's broken down obviously will be much more limited into how many words you can put into each box, but it's well worth logging in now, whatever stage you're at, looking at it, working out what you would put in each answer box and where you think you're a little bit weaker, so that's where you can focus your attentions over the next 6 months or a year, so that you've got something that can almost go in every box. So that's kind of the application process. There's then the pre-interview process, and there's a little bit of gaming that goes on here. So when you are applying for a job, you are always going to call the hospital that you want that job in. You're always going to speak with a clinical lead. You're ideally, this is even prior to submitting your application, you'll have a conversation with that clinical lead. You'll ideally want to come and look around. It's a bit of a chance for you get to come and meet the people who work there, to understand the direction of travel for that unit, what their aims are, the sorts of things that they'll be looking for in you as a prospective consultant. It's also the opportunity for you to meet as many different people as possible. Now, I would highly recommend that you actually go twice. The first time is when you are just looking to submit an application, and there you're just going to meet one of the clinical leads. And the second time is if you are fortunate enough to be invited for an interview. Actually, there's a lot more people who you'd want to speak with at that point. So when you think about the interview panel, actually there's quite a few people who sit on that panel. Generally, you'll have a panel that's going to be at least 6 people, and you'll have at least one member of the trust's executive team within that panel as well. So what you'd want to do is you'd want to meet again with the clinical lead, but you'd also want to meet with however many of the people on that panel that you can meet with. And even if you can't meet with them, just make sure that you've sent an email, or if you only get through to their secretaries, that you've left a message for their secretary, something that puts your name on their radar. So it's not that you're turning up for an interview and nobody in that clinical department has any idea who you are, because that will put you behind a little bit. I don't think there's anything such as nepotism when it comes to these jobs. That it is a lot to do with how well you perform, but you do put yourself a little bit behind if people don't know who you are, if they haven't had the opportunity to chat with you to find out what you are like as a person. So I think that is really important. If you go to an interview and you haven't spoken to people outside of the clinical lead, I think that does put you a little bit of a disadvantage, but you wouldn't be expected to do that until the point that you're invited to an interview. I can tell you from my experience of organizing an interview that actually the date is decided quite far in advance. So if you're thinking of applying for a job, one of the things you can ask when you look around is, do you know what date that interview is going to be? If you're petrified, I've got nights coming up, my nights are in 2-3 weeks time, what do I do if my interview is during those nights? You can probably ask at the point that you're applying, have you got a date set for the interview? Invariably the answer should be yes. Then when it comes to the interview itself, so I'll talk about how we did it during COVID. So it was done on MS Teams. Essentially, the candidates got given 2 separate invites. One was for their pre-interview presentation, so it was still deemed appropriate for candidates to give a presentation. Actually, doing it on Teams, doing it remotely, meant we had a much larger audience who they were presenting to. So we had quite a big multidisciplinary team who it was being presented to, who had the opportunity to ask questions, and then that team then fed back into the interview panel. The interview itself, the way it worked was that the candidate would remain on the screen with their video on the entire time, and only the person who was asking the question would leave their camera on, because otherwise you feel a little bit intimidated if you've got 6 or 8 other people who are sat there staring at you. You're not entirely sure where to go. I think it's important that you still dress appropriately as though you are going to an interview, that you look like you've made the effort, that you're wearing, that you've not just turned up in t-shirt and shorts. And then the interview process itself, as I say, there will be a large number of people who are in there. So there'll be some clinicians, there'll be somebody who's representing the trust from an HR perspective, there'll be somebody who's representing the trust from an executive perspective, whether that's the chief exec or the chief medical officer or somebody that the chief exec has nominated on their behalf. Trying to predict what the questions are going to be. So the first question is generally very predictable. The first question is always given by the college rep, and it's a question that's meant to put you at ease a little bit. It's asking you, for a little bit of background to you. It's an opportunity for you to sell yourself. So it'll be, tell me about you, or tell me why this is an appropriate job for you. And there are two ways to answer that question. The first way is to look at what the job specification is, and the kind of the essentials and the non-essential components to that, and to try and show how you have addressed all of those and why you meet the criteria. And the other is to use it as an opportunity to kind of sell yourself. So what you'd want to do is you want to think, what makes me kind of more unique than anybody else? What makes me stand out? And those are things that you can bring out there. I wouldn't be too worried about keeping your powder dry, so to speak, at this point. If you've got something that you really want to make sure you get out there, that you say to people, this is a good question to get it out in, because you can't predict what the rest of the questions are going to be. So if you've got something that you think, actually, I've done this project, I've done this presentation, I've taught on this, or something that really makes you unique, this is also a really good opportunity to bring that out. Other questions that you should be prepared for. So the panel want to know that you are safe, that you're safe as a doctor, that if you're in the hospital by yourself on an on-call, that the medicine that you're going to practice is safe. So you might not get a question that's maybe clinically related, but you will probably get something that assesses your understanding of risk, so that you would know how to escalate either clinically or operationally, to make sure all the right people know about something. And it just proves that you are safe, and that actually you are ready to make that kind of step up from registrar into consultant. So it's just showing that you understand risk processes. You may or may not get asked a clinical question. I think it depends. Generally what happens is all the panel members agree beforehand a single question that they're going to ask, and it may be a clinical question, it may not be a clinical question. Again, in pediatrics, your clinical question may cover clinical, it may cover a bit of safeguarding, it may cover that from a risk perspective, because that kind of covers all three of those things. But it's very difficult to obviously predict what your questions are going to be. The other thing that you need to do is you need to have a list of some examples in your mind that you can draw on pretty much straight away. So you could be asked something about team, either when the team has been good or bad. Again, with regard to communication, good or bad, or how you've dealt with adversity. Now, the example itself doesn't matter so much. I mean, I wouldn't bring up something that's going to have you in front of the GMC the following day, or something that actually really was a horrendous car crash. But the idea of that question is to prove that you can understand how something functioned well together, or didn't function well together, but how you can turn that round into a positive. So, I worked in this team and this didn't happen, and we realized afterwards, so we made sure as a result going forward, we always did this. Nobody wants to hear, I was part of a team and none of the patients were happy and they all complained. Actually, we realized they were complaining because of this, so we changed. We now see the patients in this order, or we bring them in at this time, and we've done something different that makes it more effective. So it shows that you can understand that there is a problem and you can grow from it. What I would really like from you is if I've never used this GoToMeeting before. I don't know if there's a hands up feature or whether you have just write questions in the chat. I'd really appreciate from you if there were questions or things that people want to understand about consultant interviews that I can try and address, as opposed to just talk about what's going through my mind at the moment, because I don't want to waste all of your time. I don't know if anybody wants to either ask a question, put something in the chat. Whether you have no questions at all. You're happy with what I've had to say so far? Yeah, do I think you can meet people of interview team? Yes, I don't think it's a problem. You know, you've got patients who are coming into hospital. I think that if you are looking for a job somewhere, if it's going to be a substantive job that you're going to be in for the next 20, 30 years, it's really important that people get that, that they get to know you, that they get to meet you. Yes, you can do that over the phone, you can do that over Teams, but sometimes there is no substitute for kind of interpersonal interaction. So to actually go down and to meet with some of the clinical team and to meet with the other people who'd be on that panel. So I'm just trying to read the rest of the questions now. What do you think about applying at a hospital you've worked as a junior and therefore know the consultant body? Yeah, definitely. As I said before, I don't think there is nepotism. I think that you can apply to a job where you haven't worked before as well. I don't think that you're at a disadvantage if you do that. Yes, it's always nice to go back to somewhere that you have worked before because you already know the people, but I still think that you need to go and you need to speak to the team there so that they are aware of you, that you've updated them on your clinical progress. Obviously, they already know a little bit about you, but you cannot turn up to an interview without having spoken to them before. What does the pre-interview presentation consist of? So again, this will vary, but it will be something related to the job. So if you're applying for a job, you know, that's the neurology lead at a hospital, it might be, you know, what do you think about developing a service? What do you think the key parts are to a service? I forgot to mention in your presentation as well, you need to keep some of it generic. So some of it needs to be about you, what you think, how you would answer that question, but some of it needs to be about the trust as well. So all trusts will have their trust values or their trust motto or their trust logo, whatever they choose to call it. You need to know about that. So that will be kind of in your pre-interview reading. To reference some of that in your presentation probably shows to people that you do understand what that trust is about. I think the worst thing you could do is to turn up to an interview and be asked, you know, thinking about our trust values, which one resonates most with you, and to have to ask what the trust values are. So I think that if you have any opportunities to put the trust values in something, you should take advantage of that, and actually your presentation will be that. So we were in the interview I did, it was looking for people who were going to work in the PAU. So it was talking about, you know, what changes we could make in a new build hospital, in a new department, how we could better facilitate patient flow. So generally the presentation will be related to what the job is. You generally won't find out what that presentation is going to be on until probably about a week before the interview, and then you'll have to submit some slides probably about 48 hours before the interview. You're also limited by time, so you will get told, you know, you have 5 minutes to present, and generally people will say to you, okay, I'm going to let you know when it's 5 minutes, and then we'll probably stop you there, and then there's the opportunity for questions. Just working my way through the other questions. Anything different for Caesar route, no non-CCT? I don't think so. I think the interview process is still going to be exactly the same. As Caesar, you may have a better rapport with a certain trust if you've worked there for longer, but I don't think any of that matters, because ultimately it's going to be the same questions that you get asked. That first question will be about selling yourself and your CV. Some of the other questions will be about how well you understand risk and the trust. And then these examples of various things that I have mentioned. Should you be honest about other choices? For example, two excellent jobs at a similar time. Do you go to? both interviews and then turn one down when offered. I think that's a horrible question, because I think that if you go somewhere and they offer you the job, and you could, if you go to an interview, you get offered the job, you can turn it down. That isn't a problem. You can almost say to them, yes, I'm really interested, but there's this other job and I know they're interviewing in 48 hours time. That already would say to me, actually, is this the right candidate for us? Because are they that committed to us, or are they going to come to us for kind of 6 months and then run away? It's very difficult to answer that question, but I think you have to play it as a game. And if anybody says to you, why do you want to come to this hospital? Because this is the hospital that works best for me. This is the one where I really feel there's something that's really special about that trust. I think if you say, yeah, I mean, it's similar to that other trust, and I like that trust just as much. When it comes to the scoring component afterwards, people won't count it against you, but they'll think, if I've got two candidates who are of a similar caliber, it's probably a little bit likely to count against you. Any other questions? Have I not answered any of those questions okay? I'll give you a couple of minutes to put anything in that chat, or just to speak up if you want to. I hope that was really helpful. I'm going to stay on the call anyway, so if anyone has any other questions, please put it in the chat and I'll try and come back to those later. I think Judith is going to speak a little bit now as well. If anybody wants to send me separate questions afterwards, I'm very happy for Katie to pass on my email details.